Hi, I'm Stella and this is Dan, and we're respiratory care practitioners with Family Medical Supply. And now that your physician and sleep study have confirmed a positive diagnosis of sleep-disordered breathing, the adventure of PAP therapy begins. Your physician has prescribed CPAP therapy, continuous positive airway pressure therapy, to splint and support your airway open throughout the night and during all periods of sleep. Your ideal therapeutic pressure, which was determined during the titration portion of your study, has been preset to your device by Family Medical Supply and cannot be changed unless so ordered by your physician. The CPAP, continuous positive airway pressure therapy, is specific to your needs and is exactly what is needed to support your airway open, so that apneas, collapses of the airway, and hypopneas, partial collapses of the airway, cannot occur throughout the night. These events can severely limit the flow of oxygen from the lungs to the heart, brain, and muscles. So by eliminating these apneas and hypopneas, you will now enjoy the benefits of good restorative sleep.
Okay, now we're going to discuss the different features of your S9 CPAP device. You have two pieces here. This is the CPAP or blower unit, and this is a humidifier. On the back, there's a button that releases the two devices for carrying and storing in your carry case. To put the two pieces together, you simply sit them on your bedside table, wherever you're going to be using them, and snap them together. Power cord goes in the back, and over on this side is a filter. You raise the filter cover, take the filter out, and dust it off about once a week. Replace as needed. Put it in at the top, snap it in at the bottom, and right above that is your secure data card. That is storing information that will be needed by your physician and or your insurance company to help you determine how your therapy is going in the future. There's a card or a sleeve provided in your kit for you to send this back to your provider, and you put the card in here, and the instructions are also on the sleeve to tell you how to take that out and send it to us. On the back of the humidifier, this is where the airflow comes out and will be attached to your hose. On the front of the unit, this is your start-stop switch. This is your information screen. To start your therapy, you simply press the button, and the therapy begins after a brief delay. You'll hear the airflow and feel it. To turn the unit off again, press the button once again. On this screen, you see some symbols. At the top, you see a little house. That's called your home screen. The middle symbol is a big drop of water. That shows the setting of your humidifier. And the bottom symbol is a ramp. What ramp is a delay in giving you the pressure. It starts at a low pressure and slowly rises up to your treatment pressure as prescribed by your physician. The humidifier setting, the higher the number, the more moisture you'll get to your upper airway. These two buttons, the top one with the little I on it, the lowercase I, is your information button. If you press that, it shows you information about your usage of the CPAP machine. The double information button here, or the one with the two clicks on it, shows you some other settings that you can change, and also what your other types of information your machine needs to give you the therapy properly, such as the type of tubing you're using and the type of nasal appliance you're using. When you turn the machine on, the first screen that you will see is a big orange screen here with the big drop of water on it. Whenever you see an orange screen, that means you can change that setting. When the unit is not blowing air, by pressing this button, you can change the color of the screen and change your setting without actually using the device. When the unit is on, it always goes back to this orange screen. When it is off, the background will be blue. You can then at that time go down to your other settings. This setting, the big green triangle, is representing a ramp setting. Right now the ramp is off. What that's telling you is that when you turn your device on, the pressure will immediately go up to your prescribed pressure. Sometimes that pressure is too much to take at start. So the ramp was designed so that you can delay that. Press the button, highlight the screen to an orange color, and you can put some time in there in 5-minute increments up to 45 minutes. Generally, there's preset at 20 minutes. Now when you turn your device on with a ramp of 20 minutes, it will start at a lower pressure and slowly increase over that period of time up to your therapeutic pressure. To add water to your humidifier, pull the release switch or the latch, raise the lid, and remove your humidifier chamber. You want to use distilled water and pour it directly into this hole here in the top of your chamber. Place the chamber back inside And once your chamber is inside the machine, avoid moving the machine around. You don't want to slosh water over to the blower unit itself. You need to clean this water chamber at least every other day, and you need to change that water and wash it with a warm soapy solution like Ivory or something else, mild soap solution. You can open this chamber for cleaning, opening those 4 latches and take it apart, give it a good washing. Make sure you have enough water in the unit each night for your therapeutic time. There's a yellow indicator inside here. It has a little arrow pointing up to the word max. That's your maximum fill line. Just don't overfill it. One corner is different from the other, so you can't accidentally or improperly put that back inside there. Close the lid tightly and make sure there are no leaks.
Now that you're acquainted with your device, let's get your therapy to you. We're going to be using that tubing, which will attach to the back of the device. This tubing needs to be removed at least once a week, thrown in a sink full of soapy warm water, rinsed real well, and allowed to air dry before you reattach. We most commonly use 3 different types of nasal applications. One is the nasal pillow system, which sits just under your nares. The second is nasal mask system, which merely covers your nose. And the third being the full face mask, which covers your nose and your mouth. On the front of each of these systems is an exhalation port. This exhalation port will leak whether you're inhaling or exhaling. It's a good leak. Please do not try to correct it. Your device is delivering good air in, and we need a port for bad gas to escape. We attach the nasal pillow system to the tubing by using the connectors. Once we have that in place, we turn the device on, and we get ready to apply. Nasal pillows in hand, the base of the nose, straps go over the head, down the back of the head, and to the top. You want to make sure that the nasal pillows are secure in your nares. You don't want any leaking, but you want to make sure that you're as comfortable as possible.
With your CPAP device, you've been provided with a user's manual. In that manual, it gives you reference to all the things we've talked about today, all the different screens, and also some cleaning instructions. You also have a quick starter guide that walks you quickly, gives you a simple 2-page guide on how to put this thing together and how to clean it. And on the back are your settings and some troubleshooting guides and when you should replace your supplies.